and welcome to All Things Medicare. Tonight's a special program. I'm Joey Bright. I have owner Cheryl Braswell, 20-year retired Marine Jeremy Crawford, and we're going to address some questions that you may have tonight, and it's dedicated to who? Our men and women of the armed services, dealing with benefits. So many questions have come in since the last show that we did, and we were asked to do this show for you. So guys, let's just jump right into it, and for our listening audience, let's start asking some questions and giving some good answers. Jeremy, I'm gonna jump right in. Can a veteran have more than one health plan in other, as you know in the listening audience, the VA benefits? Maybe it's TRICARE. But Jeremy, can they have more than one?
Yeah, the simple answer is that they can have more than one health plan or one type of coverage. It really just depends on their situation and what gaps might be present, either through their VA coverage that they're trying to supplement, right, or depending on how much service they had, because even though they have VA coverage, it's not the same universally across all veterans. But yes, to answer the question, you can have more than one plan coverage. Just really depends on what is the best for your situation.
Jeremy, does that relate to, and again, the listening audience, with disability? There are some veterans, men and women, that have, I don't know, 10%, 15%. Then you have the extreme, 50, 70, 80%. Do the benefits matter? Do they make a difference when they have their disability and it's different within the percentage of disability?
It does. That's why I was mentioning before that there's really a big difference. For myself, I'm a 20-year Marine, so most of the VA benefits that I'm entitled to aren't actually tied to a service-connected disability. They're tied to an amount of service and the retirement classification. For other veterans who might have only served 4 years or 6 years, when they leave active duty, they're actually entitled to VA benefits either based off of their disability or based off of some sort of award they received while they were on active duty. We won't go that deep tonight, but some of it might relate to receiving the Purple Heart. Some of it might relate to receiving the Medal of Honor. But there's a much wider range of what benefits that are provided to the non-retiree. And then, of course, in the middle is the veteran who had somewhere between 2 years and 20 years, but retired medically. They're considered medically retired, and they get a lot of the same benefits I do, but there's still a range. So it really does depend on their classification, their type of disability, if any, and what coverages they rate because of their service.
So could the audience call in to Statewide and speak to Jeremy and speak to Cheryl about a question you may have about your disability and how it relates to some of the programs that we want to add and talk about tonight, in addition to TRICARE and the VA? Cheryl, did you have a question?
One thing I wanted to point out, and you know, we speak to the audience when we do this. We're trying to develop a resource at Statewide Insurers Group for the veterans to be able to call in and take advantage of, and that's a big part of what, you know, Jeremy's coming on board for, is to develop these things, not just Medicare related questions that veterans can have, but you know, like you're saying, the guys who've been in there 2 years to 20 years and, you know, everywhere in between. And because you're even now, in just a little short time we've been working, you're finding resources out here for different things that you were even talking about before the show started. And that's what we're trying to do, is build that resource. So, you know, as you're watching this evening, if you have that ability, if you have a resource that we may not know about, please call in, let us know about it, so we can incorporate that into the knowledge base that we're trying to build, you know, with this veterans organization.
And that's actually what got this program started, was thanks to Jeremy and Cheryl. We had so many of our vets calling Statewide because we insure everything. And if you can name it, it's insured under Statewide Insurers. Well, this surfaced when Jeremy started coming in and saying, Joey, we have questions about, and all of a sudden, here we sit before you. So take a moment. If we could have production possibly put up our telephone number, Cheryl, that is
252-316-8166.
Outstanding. Jeremy, is there anything as an example possibly we could use? I've got a couple, even with my father, but I'll save that till later. But is there an example to where let's say someone has VA benefits, but they've heard of a program to where they can add to that. Cheryl, what would that program be named that they could add to it?
One of the simple plans that we can help them get enrolled in is just, they're called Medicare Advantage plans. And there are many levels, types of Medicare Advantage plans, but there are one or two that really fit with VA benefits. They do not take away from anything that you would have through VA or TRICARE for life, but these are things that can be just layered on top of what you already have and give you some additional benefits you can take advantage of. And these programs do not have any cost to the veteran to be
So there's
enrolled
no
in.
cost to our listening audience
There's no cost
to add
to
these
the veteran.
particular benefits. And ladies and gentlemen, we're not going veterans. We're not going to get into the weeds tonight. That's why we're encouraging you to call Jeremy, call Cheryl, and ask that question of, well, gentlemen, what are these benefits you're talking about so much on TV? Jeremy, is there an example you may have?
I actually have one that might fit what you're trying to talk about, and Cheryl's mention of the network of resources. Recently, I had a veteran come up to me. He lives out in Bertie County, and so the medical resources are a little bit limited out that direction. And he had 4 years in the Army, and he wanted to be able to find out what medical coverage he could get. He hadn't had a service-connected disability assigned just yet, and so he was not having any VA benefits. He wasn't old enough for Medicare or Medicaid. He didn't qualify for Medicaid. So he was wanting to know, where do I start? And the look of confusion on his face was just, it was obvious that he didn't have a clue. But our television show a few weeks back, where we talked about the veterans, he saw us on there, he got our number, and he called me up. And he said, hey, how do I get started? With the help of some of our veteran service officers here in Nash County and in Bertie County, we got him pointed in the right direction so he knows where to go. I won't get into what he actually is able to get a hold of, but
Sure.
he actually has access now to some resources that he didn't have before. And it wasn't that Statewide solved his problem, but we were able to point him in the right direction because of the network we're building.
Absolutely. And Cheryl, you want to add to that of anything at all there?
Just one thing I thought of while we're talking, our telephone number is on the screen, but also you can go to a website that we have called MedicareStatewide.org. MedicareStatewide.org. There's a lot of information there that is, obviously Medicare related, but you can send us a message there. Go on the website, send us a message, and any question you have related to any veteran situation, any questions you have about that will get right to us, and we can respond to you. Give us your phone number, your email address, and we'll respond to you.
So one of the great things then for both of you gentlemen and our listening audience is to set up a line of communication.
Yep.
I know there are many in the audience right now that may not feel encouraged to pick the phone up and want to talk to a 20-year vet, or maybe want to talk to Mr. Braswell. But the only way we can help is for you to reach out and let us know. So text us, call us, write us. We're right here local in Nash County, and that's how we're able to get out. Jeremy, I got a second question if I can jump into it.
Sure.
Will a veteran lose any his or her benefits by enrolling in this plan that Mr. Braswell was talking about that we're adding on TRICARE, a layer for the VA? So I'll repeat that. Will a veteran, him or her, lose any benefits by enrolling in a Medicare Advantage plan?
Well, Joey, that's a very important question, and I have no doubt anybody who's ever considered adding a coverage has given it some thought. And while the other side of the coin, for those who aren't veterans, who may not have veterans VA coverage or TRICARE for life coverage, there's a bit more security in that. No, it does not automatically cancel, terminate, or suspend any coverage they had through the VA.
Oh, good.
Matter of fact, in order to shut down what you've gotten from the VA or from myself through TRICARE because of my retirement, you have to purposely go in and elect to turn off those coverages. And based on the benefits and the cost, I'm not sure of anybody in 9 years since I retired that has ever told me they turned it off.
No.
So the answer is no. It's not an automatic. It's not going to shut it off. You have to purposely do that.
So really, guys, the only fear for you sitting out there and us sitting at this table is that communication. For you to find out what is available for all of us is to do what? Again, pick that phone up. Make a communication, text, telephone. It's a different world we live in now. I use the example, and then I'm going to turn this over to Cheryl for his points here. My father, 90 years old, military. Dad, unfortunately, has had stroke. He's had 3. He's beat cancer twice. I take him to the VA Thursday for a treatment. The VA has been there. For that situation with his age, I would encourage all who's listening, for your 85 to 90, stay where you are. Do not change anything that you currently have that has been working for you. What we're looking at is what Jeremy talked about with his experiences from the standpoint of what? If you're looking for something at no cost, but you don't know where to go, these 2 gentlemen sitting on my left have the answers and the resources if they don't have the answers, but the resources to find them. Cheryl?
Yeah. The thing I want you to understand, the plans that can be layered on top of what you have through the VA, some of the, and I know this varies for the different types of coverage that the veteran will have, but you can have additional dental benefits or layered on top of what you may be able to get through the VA, help with hearing aids, and we've had several people that we've worked with on that have been and had the hearing aid benefit already used, and they were ecstatic at what they were able to accomplish through that, and what very little amount of money they had to actually take out of their pocket to help cover the cost of the hearing aids for them. There's depending on the plans, there are transportation benefits. I had personal experience with that one. I had a gentleman who lived in Gaston, just above Roanoke Rapids, and he was going to the VA hospital in Durham, and he was having to pay for his transportation
For
back
that
and forth.
transportation for it,
We got him enrolled in this program, and he ended up spending, he reduced his, we sat there that day and literally figured up what he was having to pay, and he was able to reduce his transportation costs. I remember the number, because 96%.
And that's unheard of.
Yeah, 96% drop, in what he was going to have to pay to go back and forth. So that was a distinct monetary savings for him immediately.
As we all know, it's not how much money you have, it's how much you're able to keep. Maximizing your benefits. Jeremy, anything you want to add before we get ready to go to break?
Well, I was going to add is that I think the key reason behind a benefit like that is that they know that if they can get you to the preventative care and keep you well, that the costs are lower on the other end.
Oh, absolutely.
For the carriers.
Good point.
So it's the veterans, search the YouTube, search the internet, that key phrase, benefits veterans do not know about, and you'll find millions of videos about all these things out there that veterans are just not aware of, and that's where I get a lot of the start of my information. I start digging.
Okay.
But so you have a carrier who wants your well-being to be taken care of, so they're willing to provide a benefit to keep you healthy, and if you just didn't know it, you're paying 96% more transportation costs.
And guys, these questions that you're hearing tonight, and you've only heard a couple of 3 or 4, they've come in from you, the listening audience, who has called, as Jeremy said, after the show last time. So again, we encourage you, give us a call, let us know what that concern is, what that need is. You're looking at 2 professionals, Mr. Braswell, Jeremy Crawford, right here with the experience in the military. What else could you ask for? But you have to get in touch with us. And I'm sure at this moment we're getting ready to have us a little break. Stay tuned, but if you think of a question or what have you, remember to jot it down. We will be on live tomorrow by the telephones, in the office, wherever we need. Please reach out to us. And we'll be back right after this message. Stay tuned.
If you recently lost your job and your health coverage due to the COVID-19 pandemic, and you think you may be eligible for Medicare, you probably have more questions than answers right now. Statewide Insurers Group, All Things Medicare, can help you with that. we can provide the guidance and the answers that you need to get the benefits you may be eligible for. Don't let this time of uncertainty jeopardize your eligibility for your Medicare benefits. Remember, relationships matter. Call Statewide Insurers Group today for the answers that you need now. 316-8166.
And we're back. And I hope you've been sitting on that couch talking to your spouse, kids, or maybe another veteran, discussing on what we're talking about, the benefits for our veterans. Now remember, Statewide is right here in Nash County. We are local. We're easy to be accessible. But the only way we can find out something is for you to reach out to us like these fine folks did, the captains, lieutenants that have called us. Cheryl, anything you'd like to add, sir?
Just a couple of points to give you an idea of other services you can use locally. If you have one of these plans layered on top of the benefits that you have now, if you don't have access, if you're having to go to the VA to get your prescriptions done, you can use these programs and be able to get your prescriptions locally.
Correct.
Save you that trip to Richmond or to Durham or wherever you're having to go to a clinic. And hopefully maybe have a no copay or a much lower copay.
Oh, that's great. Is that something like what we know on the Civi side? You're able to actually get medication for 90 days, and
Yes.
some of the situations you would receive would be $0 in
Yes.
copays coming out of their pocket?
Yes.
Yes.
Okey-doke. Jeremy,
To give
go
you an
ahead.
example, the three basic lanes that people would get their prescription drugs filled through the VA system is either through a military treatment facility or what's known as an MTF. That's if you're close enough to Seymour Johnson, if you're close enough to Camp Lejeune down in Jacksonville, or if you can get it through a VA system facility like the one in Durham. Then there's a local pharmacy through a private organization like CVS, Walgreens. And then, of course, there are the direct mail organizations like Express Scripts. I know for my family, for everything that's not considered acute, anything that's a maintenance medication, we get it through Express Scripts, and our copay is $0 for 90 days on everything that we actually have in our family.
So you're already experiencing this?
Right.
I didn't know that. Very good.
In some past situations, we've had some really specialized medications that were quite painful if somebody had to pay for them out of pocket because they were $15,000 a shot. And the medication for maintaining that prescription was $8,000 a month. Fortunately, with our
my
VA
gosh.
benefits,
Wow.
it was almost zero. So, but those are the three basic lanes.
Yeah.
MTF, local pharmacy, or a company like Express Scripts. And when we get a chance to meet with a veteran or even non-veterans to discuss what they might need, we can certainly help you chart the right path for what is the easiest way to get the medications you need. Because even within the private carriers, the formulary of drugs that they have available is different with each one. So it really is a matter of putting the square peg in the square hole. That's the easiest analogy I can use for.
That's a good analogy. It works. It works. Do either one of you gentlemen have, for our listening audience, an example, whether, as we spoke about earlier in the first segment, personal, a friend, another question that one of our viewers called in? I think now would be the time if you want to kind of step up and let me know, because I am done here with what I had that called in to me. Cheryl, do you have anything, or Jeremy, do you have anything you want to kind of step up what we have for the viewing audience?
I have something unless you were ready.
Go ahead.
Okay.
Yeah.
This is a bit off the lane of Medicare, but it's still within the insurance lane that we service. I had a veteran call me the other day, and he wanted me to point him towards a resource who could help him find what was an insurance policy for himself that was consistent with what's known as Service Members Group Life Insurance, or SGLI. It didn't take long for me to go through a couple of questions and find out that he had already gotten past all of the major milestones that would allow him to qualify for SGLI, VGLI, which is Veterans Group Life Insurance.
Life.
And he certainly wasn't old enough for a lot of the Vietnam era life insurance policies. And so with those few questions out of the way, I was able to show him, hey, here's where you can look at private insurers that we represent as a way of providing yourself that life insurance coverage. So while I had the network of information, and that's what he was after, veterans not knowing what benefits they're entitled to,
Right.
he actually was no longer entitled to that set of benefits he believed he was entitled to. So in the veterans community, it can very easily be, they don't know what they don't know. What they do know might not be totally accurate, or they've been given wrong information by another veteran
Right.
who they themselves didn't know. So this network is really working out great for several veterans that I've talked with lately.
What a great point. And again, here we go, we've said it 3 or 4 times. If there's questions that you do not have answers, let's say you've called Durham, let's say you've called Richmond, Fayetteville, wherever some of these hubs are, our hospitals for the VA, and you don't have the answers, go locally. We have a lot of resources right here in Nash County that I feel like, gentlemen, ladies, and our veterans, that are underutilized, that are not really maximized to find out. We have to get off that couch. We have to be proactive. We have to go out and seek. And that's what we do here and why we're in front of you tonight. And why this program was dedicated to our veterans. For what you've done for this great country, it's time for someone else to do something for you. So reach out to us so we're able to do what? What Jeremy and Cheryl has been saying all along. Cheryl, do you want to add something?
Please understand, what we are doing for you. There is not a cost to you for the services that we're providing.
No.
The carriers, the people we direct you to, if there's a program that fits what you need, that carrier takes care of us. They reimburse us. And so please understand, that's the value we bring to the table. It does not, you're not incurring a cost by having us find these things out for you and track this information down and provide it to you. And the thing that I'm learning very quickly is the carriers that are really doing a lot of work in the veterans markets, they are doing their homework. And they are having people who, most of the people that I talk with from the carriers are guys who are veterans, anywhere, even like Jeremy, been there 20 plus years, to especially the larger carriers, that our local representative for our area are both gentlemen that have 20 years plus. One is Marine, and the other gentleman is Air Force, I believe.
Correct.
But these folks, they are very serious about what they are doing and the service that they're bringing out for the veterans. And so I'm tickled to death of what we're able to learn from them. And I know, in my heart, that what we're bringing out to you is the best that can be brought.
What great points, what great points. Jeremy,
So-
you want to add something to that?
Well, yeah, I think we talked about this the last time I was here with you guys, and that is, I really enjoy connecting with veterans who are representing an organization that I have a need to work with.
Hear, hear.
And I actively seek out that veteran's representative because I know he understands my language. He's,
Right.
to use a cliche phrase, he's chewed some of the same dirt, and he's been to some of the same nasty places. And when we talk, we seem to get each other. And so I actively look for those veterans. And it's not surprised me that so many veterans try to find opportunities to work in roles representing veterans with their organization.
Hear, hear.
Because they want to be a part of that community. And so, unlike some of the others that might be around here who have great information, they just can't speak the language, they don't understand what the veteran is trying to address, and there are a lot of experiences they just cannot enjoy, if that's a word.
Great word.
Right? So I find it's a lot of value to reach out to the veteran in that particular organization and connect with them, because it's like an instant bond.
Yes.
And I can get right to what I need. I don't have to tap dance around anything. I don't have to explain my background. He's like, no, dog, I get it. Let's just get what you need.
And the great thing about that, gentlemen, I don't know the viewing audience of where we are, 17 counties or whatever, how many people we are reaching. We are centrally located. Reach out to us. As Mr. Braswell, Cheryl said, and Jeremy said so graciously, there are organizations out there. Maybe you do not know where these organizations are. Jeremy is a great resource.
Yes.
And myself being a civvy, not knowing what Jeremy has gone through for this great country, it is a time for you to reach out to one of your fellow, male or female, to be able to what? Talk the talk, walk the walk. And being able to do it right here on Statewide is what we do. I know we only have a couple of minutes left. Gosh, I wish we could sit here and talk for an hour, but it goes by so fast. I encourage you again, as I turn this next segment over to Cheryl here, the last minute or so before we close, call us. Ask for Jeremy personally. Ask for Cheryl personally. We want nothing from you. We want to bring something to you by the knowledge we've gained. And Jeremy, before I throw it to Cheryl, is there an organization that you've touched on here in Nash County that's getting back to you, that is maybe a group of, whether it's Marines or Joint Force or whoever that you've talked to that has been receptive to where we're going with this?
Well, they've all been pretty receptive. I would say the ones that stand out to me, American Legion, the BFW, Disabled American Veterans, all great organizations. I have yet to find one that has said, yeah, you're bothering me, go away. It just doesn't happen.
Outstanding. Well, good. Cheryl, anything you want to add here towards the end of where we're going?
Please give us a call. Reach out and let us be a resource for you. And if you have information that is valuable, to all veterans, please let us get that from you if there's a resource you have that we may not know about, because again, we want to build a resource that you can come to as a veteran, or veteran's family can come to and get information that will help you out.
And in closing, if you find right here at WHIG that you can't get in touch, you didn't see that telephone number up there, and I'm going to ask Cheryl to repeat that in just a moment, call the TV station. Ask the TV station, who were those guys on talking about veterans? That whole point is where we get started and how we do what? I'll use some of Jeremy's words. We relate to you. We turn you over with the same mindset with Jeremy, because he's been right where you have. To use his words, we chewed some of the same dirt. Cheryl is in the office. Jeremy is. Give us a call. Gentlemen, anything you'd like to close with?
Folks, our phone number is 252-316-8166, and the website that you can go to is medicarestatewide.org. And you can send us a message right there through the website, and you may find some information on the site that can help you.
Jeremy, anything you want to close?
One last thing. This week, my Facebook page is going live for my veterans resources. You can find me at SIGVETREP, SIGVETREP.
Would you repeat that one last time?
Sure, absolutely. It's SIGVETREP. It's short for Statewide Insurers Group, Veterans Representative.
Outstanding. Ladies and gentlemen, veterans, we thank you for your service.
Yes.
Tune in. We hope to bring you another program. We thank you. God bless you all.